So this is my Midwifery 3030 journal entry for assignment 3-1. So I'm going to report to you the case. So the case is we had a multip mom. She just had, she was a multip mom. She had 2 previous hospital births that were pretty remarkable, nothing to report. And then she came to our care to switch to home birth. And again, she had a very straightforward pregnancy, a very straightforward labor and delivery, and there was nothing to really note or kind of talk about or give you information on for her case. Everything was really normal and straightforward at the birth. It was about a 6-hour labor. She labored in her tub, and baby was born pretty quickly. No resuscitation. Baby cried right away, and we moved mom to bed. And it was about an hour and a half after the birth, I did the newborn exam, and we noticed that baby was very, very loud and very grunty, which we had been hearing for that hour and a half after the birth. It didn't just start randomly. We kind of had been hearing it, but babies are always a little like, continuing to clear fluid after the birth, so there was nothing that we were overly concerned about. Respirations immediately after the birth appeared normal, like within that first 20 minutes. They were pretty normal, and then when I did the newborn exam around an hour and a half later, the respirations were 76. So I knew that that was slightly elevated than within the normal range of 40 to 60. And when I listened to the lungs sounded pretty clear. So there was a little bit of a mystery of what was going on because the lungs were clear, but baby sounded extremely loud when they were breathing. I've never heard a baby quite this loud when they're taking breaths. I'm trying to think of anything significant in that short time period. I don't think so. We did the newborn exam. Everything else appeared really normal. We put baby back skin to skin. Baby latched, baby nursed. Again, just like really loud and kind of grunty. More through the nose. I mean, also mouth too, but just very, very loud. So, but more through the nose, I think you could really hear like the breaths going in and out. It almost sounded like he was having like to really breathe in and really breathe out. But there was no retraction in, the lungs or throat or anything like that going on. So, we just said, okay, we will wait to see how this baby does before we leave. And, if there's any concerns, we will transfer. So by the time I checked respirations again, respirations were back down to about 60. So within normal range, and, baby was nursing. Everything else seemed really, really normal. Baby was just kind of a loud breather at that point. And, we decided to leave. We let mom know that obviously we were still on call for her and to let us know if anything was going on. We played close attention to discharge paperwork and the breathing of the baby, more so than we would normal if there's any retractions, and kind of like walked her through anything that should be concerning and she should be looking out for, to please let us know. So we went back 24 hours. Baby still sounded the same, but everything else was still within normal range. We went back on day 3 and baby sounded like almost louder. So we referred the baby at that point. We said we really would like him to get checked out by a pediatrician just to make sure everything's fine. Although everything appears normal, we're still hearing this like great effort to take in a breath and breathe out. It just sounds so loud. And the mom was definitely noticing it too, from the time of birth. And then she had sent us some episodes of him choking and gagging.
Where's Ruby?
I don't know, honey, but mommy's trying to finish. Choking and gagging that the mom was kind of getting concerned about. So she decided to go into the pediatrician on day 3. Pediatrician said, again, everything seems normal. Let's wait a couple days and see if it's just like the afterbirth of him clearing all the things. So they went back at 1 week. When they went back at 1 week, the pediatrician was a little bit more concerned that he still sounded just as loud, and they decided to refer him to an ENT. So at 1 week, 6 days, the baby was referred to an ENT, and baby did get scoped. and the ENT's diagnosis was that baby had a significant narrowing of the nasal passage, and which was making like the really like breathe in, breathe out, like whistle, just loud. I've never heard anything like it. It was so loud. Sound. And that there was no concern for the baby's overall health, that he should grow out of this over time, but that ENT was going to be following him closely and, you know, going to want to see him again at, I think, 2 months, and like see how it goes after that. So at that point, baby was out of our care, so we haven't had any follow-up since, but mom was just like, yeah, baby's a loud breather, like, what are we gonna do? So that is the reporting phase kind of my journal. And then the response was, we really wanted to make sure that baby was back down to normal respirations by the time we left, that the baby's lungs were clear, that baby was eating, that baby was maintaining temperature, that those things were within normal. And, you know, if a baby is struggling to breathe, especially a newborn, that they will crash rather quickly. So we wanted to make sure that we weren't leaving with a baby that was about to crash, right? Because that's absolutely terrible, and we would never want to do that. But everything that we were hearing was normal. Baby was eating perfectly fine. Latch was good. So we felt very comfortable leaving at that time. We did give baby some homeopathy of, I don't have it here, but I'll make sure it's in my notes. It's to help with clear respirations. So we did give baby some of that, like clear fluid. And there was no real change. So after we kind of went through all of our thoughts and feelings, we determined that baby was safe enough, breathing fine, normal in a lot of other aspects for us to leave. And we, you know, ran through our checklist and our knowledge of our own experience of, you know, what are the risk factors of leaving and baby kind of crashing, and none of those risk factors were present. So, so yeah, because this was such an unusual case, we ran through all the things of what we know to be normal. And like I said, if baby was outside of that normal range, we would have transferred. Okay. And then like kind of how can I plan for this in the future? I think anytime a baby is having abnormal breathing habits, then you need to run through your checklist of what's normal and what's abnormal. Every case will be very, very, personalized. And every case will be personalized, and this is a case-by-case basis to assess a newborn's breathing, whether to determine to transfer or not. In this case, we determined that it was safe for baby to stay home, and that when we came back, if things weren't cleared, that we would refer them to the pediatrician, in which we did do on day 3. And it turns out that it was just a narrowing of the nasal passage. So I thought this was an interesting case because there was a lot of talk for the first week of what was going on with this baby's breathing. And it just turns out that it was something actually really simple. Not simple, but it was nothing like life-threatening or concerning in that moment. It was just a narrow nasal passage. So that is my case and my reflection on that. I think I learned a lot from the case because I've always been a part of these big emergent transfers, and this wasn't. So it was more interesting to kind of sit back and like run through our things of like, okay, it's time to refer now, and it's time to see what the ENT has to say. And I just thought it was more interesting. It was more of like an acute, what's going on with this baby, rather than like an emergency, this baby needs to be seen now. So here's my notes I have for this case, and I will present them with this video.